Dr. Ted?
Yes, good morning and thank you very much. Magandang umaga sa ating health heroes that are all listening. Allow me to share my screen and allow me to greet Mayor Joy Belmonte. Am I sharing my screen now? Yes. Mayor Belmonte was with us last Saturday. The National Task Force, together with our code team, visited the Quezon City. And for the first time, I heard the efforts of, I reside in Quezon City, the efforts of the mayor. I've been working with the National Task Force since March. But I am very happy to congratulate the good mayor. I think the good mayor is in the category of the women leaders that have been able to fight the epidemic and the pandemic globally. When this project, the BantAI COVID project, was presented to me as an advisor of the National Task Force, I was immediately amazed. First of all, the project uses technology, which is what we want, so that we can actually hasten the containment of this virus. Number two, it uses the power of public-private partnership. And then number three, most important, I think, is the malasakit that it brings. I too was positive and I was isolated for 14 days. And it's very difficult when you have no contact to the outside world. I even valued the contact tracer. He was a policeman. Yung contact tracer was the one asking me about my symptoms because I was asymptomatic. So maybe that's why I didn't have a doctor. I was opting to go to PGH, my hospital, but the director, Dr. Gaspi, told me, if you're asymptomatic, you'll be on the 7th floor, and there is no nurse to take care of you. I said, I prefer to be on home quarantine. But congratulations to Lawyer Rense for the effort that you actually put together. I've been waiting to see a project like this be brought to us. There were many small projects or pilot projects using technology being shown to us at the National Task Force. But when they presented to me this project last week, I was immediately struck by the extent of how it actually provided the necessary tools to actually contain this virus. So on the screen now, if you're seeing my screen, is the National Action Plan Phase 2. Phase 2 is from July, August, and September. And Phase 1 was March to June. And in Phase 1, we actually tried to ramp up our facilities and our testing. Now that we have that, we have over 104 testing centers and we have several treatment facilities. We are now concentrating on contact tracing. We appointed a contact tracing czar, Mayor Magalong, who's very aggressive. In fact, you heard the mayor speak about how difficult attaining 1:37. Most of the local governments are able to attain 1:20 with the increased efforts of Mayor Magalong. But indeed, as we do contact tracing, we are able to do more tests. We're able to identify and isolate these people. And this is where BantAI COVID becomes very useful, because the moment you are positive, what happens is the Quezon City Epidemiology Surveillance Unit enrolls them to this project. And once they're enrolled, there are about 70 doctors that actually look at you or are assigned to the different patients that they can follow up over the period of time, maybe about 14 days, until they are discharged from that particular isolation, which is a great help in terms of what the government can do. Mayor Belmonte mentioned how difficult it would be if we contact traced everybody. And this is why public-private partnership is really very important. In the screen, you see the National Action Plan. The National Action Plan is shortly called PDITR strategy. But the focus or mantra of this is national government enabled, local government led, and people-centered. So people-centered, the key in the fight now, as we know, the national government is able to come up with the strategy and the plan and is giving the support to the local government. Local chief executives like Mayor Belmonte, it's up to them to implement, especially in a very big city like Quezon City, and one of the first to actually get outbreaks, and one of the first to actually implement what they called special concern lockdowns, wherein they lock down specific barangays that have big outbreaks to contain them. So it's very important to use all the tools we have. The solidarity is important in terms of everybody to be able to implement this. Prevention and containment is now the focus of National Action Plan Phase 2. And in prevention, let me emphasize that this is the washing of hands for at least 20 seconds, the physical distancing, that we actually do 1 to 2 meters of distancing, the wearing of face masks and face shields, personal hygiene. When you go out of the house, you come back, you take a shower, throw your clothes into the wash bin, and then the localized community lockdowns, which will prevent more transmission. So, and then nag-add na ngayon si Mayor Melbon, we've now seen that with the GCQ, the implementation, the transmission is now in the working age group, which is the 25 to 35 age group. Dun dumadami ngayon yung infection. And we need to find a way to actually contain that so that we can dance with this virus. Allow me to show the next slide. This is my last slide, and this is just an emphasis on the prevention part, the minimum public health standards and healthcare implementation for COVID-19. Number one is to promote and practice proper hygiene. We want all the doctors of PMA, maybe the media here, to really promote this, enforce the wearing of masks. Actually, to me, it's not enforced. We're actually giving away. Yes, last Saturday, we turned over thousands of face masks to be given to Quezon City and to the poor communities, to the people who cannot afford to buy masks. These are cloth, washable masks, 3 layers, and can be used by our citizens. We teach our citizens about coughing hygiene, and then we promote the washing of hands. Number 2 is really the enforcing of physical distancing. If you need to stay home, just stay home. Don't go out. If you are at risk, you're elderly, you probably need to be staying at home. And then restrict mass gathering events, yung mga concert, yung mga rally, tama na muna yan. Even the religious groups, prayer groups are also limited at this time. And we enable business to do some level of contact with all the preparations. And then all the vulnerable people, as I said, should actually stay home. And of course, the temperature check in establishments. With that, I think the message is about solidarity. I congratulate the Philippine Medical Association, the Quezon City Medical Association, the Vireo group led by Loida Orense, our city mayor, Mayor Joy Belmonte, for coming together, consolidating all the efforts. This is about inclusive approach. We don't reject people. If you want to offer help and the help is aligned with the efforts of the national government and the efforts of the local government, and it will help contain COVID, this is all welcome, and congratulations to everyone. Stay safe, and again, happy National Heroes Day to our health heroes out there. Magandang umaga po sa inyong lahat.